We as an administration take the health of our people, our health very seriously, and we put in place a serious plan to enhance health services to the people of Migori. In our plan, we have quite a number of facilities that we thought required upgrading. We started by upgrading and also doing facelift in all our facilities so that they could be usable. And in that quest, we also started looking for partners. And in that quest, we came by M-Pesa and Safaricom PLC, who are an entity that is a Kenyan entity, put up in Kenya and able to serve us Kenyans in offering telephone and data services. But in their corporate social responsibility, they are involved in assisting and in partnering with the county governments and national governments on matters that are important to the people of Kenya. In the context and case of Migori, we approached M-Pesa Foundation and requested that they partner with us. Sometime last year, I think towards the end of last year, we broke the ground here with the hope that this facility would be constructed and operationalized. I want to report today that the facility, with the help of M-Pesa Foundation, is what you see it today. The county government of Migori, headed by myself, has been able to recruit staff, deploy them here, has been able to purchase medicine and other equipment, and is now fully operating this facility. When you look at this facility has a very large catchment area. It has a catchment area that is part of Homa Bay County, part of Narok County, and also quite a number of neighboring sub-counties, including Kisii. I am informed that since the doors of this facility was opened, that the doors to people to receive the treatment, the facility has been full. So I am happy to report that this facility, construction and operation have been timely. It was constructed in an efficient and timely way. Operation has been top-notch, spot-on, and it's operating. What I want to say is that we already needed to expand it. When you go in there, you can see that it is full. You can see healthy mothers and newborn babies. The in charge of the facility has also reported that since it was opened, no child has been lost. And we are quite upbeat that loss of life or additional suffering is now controlled. The rest we leave to God. So allow me to take this opportunity to thank M-Pesa Foundation through the chair for their kindness, and also to thank the engineers who did the construction, the contractor, and my staff, and people of Migori County for making good use of this facility. In our health plans, we have many more facilities that we intend to expand. We are investing heavily in equipping facilities. We are investing heavily in giving stock of medicine to our facilities. We are investing heavily in digitalizing our facilities, and also in hiring personnel. In the recent hiring of personnel that we undertook, 30% of the people we hired were health staff. So as a county, we focus on hiring personnel. As a county, we focus on equipping our facilities. As a county, we focus on looking for partners and partnership in order to help us put up new infrastructure. And we'll continue doing this so that our people benefit from this. What we are still requesting of Safaricom Foundation, and it appears that there is optimism, is to help us mobilize more resources so that we have similar facilities in other parts of this county. We have needs in places in Korea, probably the area of Kihancha. We have serious needs in Nyatike and also in Suna area. The maternal death systems, the increased maternal deaths and increased death of children is as a result of many factors. One of the factors is the absence of theater. When a normal delivery, when normal delivery is not possible, it is important and imperative to have a theater close by or within the same facility where the mother can be attended to by a more specialized person. In this facility, we have a theater and it's operational. Previously, we didn't have facilities with a theater, so when difficulty in birth was encountered, it is difficult. We have other facilities with theater, so we continue constructing theaters. We continue equipping them. We continue hiring specialists to be on standby or within reach to attend to those mothers. And I want to promise that by and by, we will have very few unavoidable maternal deaths. And in fact, we are looking forward to a time when maternal deaths will not be there. I hope that is possible here on earth, but we want it to happen in Migori.
Kwa majina ni Amos Nyaribo, gavana wa kaunti ya Nyamira. Vile mnajua leo tumeweka foundation stone kwa mradi ambayo imekuwa sponsored na M-Pesa Foundation. Wametoa milioni 60 kujenga hii mradi kwa miezi 6. Haja ya sisi kuandikia hao na kuomba usaidizi huo ni kwa sababu mkiona ile facility tuko huko ya maternity haitoshi. Population imekuwa mingi na standard yake iko chini. Ndio tukaandika proposal nao kwa moyo yao mzuri wakakubali. Sasa tumeanza hii mradi ambayo itachukua 6 months. Ndio tumekuja hapa kufanya foundation stone na kuwashukuru. Hiyo tu, hatuna mengi. Kazi yetu ni kueneza ile National Universal Health Coverage ambayo part of it ndio hii, kwa sababu kila kitu inaanzia ground na ikiendelea na kwingine. Vile nilisema, tulifanya moja Kerenyo, tulifanya moja ambayo itashindilia karibuni huko Naitambe, tulifanya moja huko Keroka, na ingine tutafanya. Tumepata mtu wa kusaidia kutoa pesa na kufanya huko Mokomoni, Borabu. Kwa hiyo tunataka watu wetu wakae na afya, ndio watoto wazaliwe kwa njia ya afya na waweze kusoma njia mzuri, ndio mambo ya kesho ikuwe certain.
So my name is Joe Gutu, Chairman Safaricom Foundation. The genesis of this project, the maternal and child unit that is being handed over today, was a meeting that took place in the governor's office. And what drove that meeting was the demographic and health survey, which showed that Migori County has one of the highest maternal deaths. The figures are between 550 and 600. That is extremely, extremely high. And so we formed this partnership with the county government of Migori. And in the process, Awendo Sub-County Hospital was identified as perhaps the first unit for us to come in and to support the refurbishment, the expansion, and together with the county government, the equipping of this facility. As the governor has said, the catchment area here is huge. We are looking at 145,000 people that are likely to be supported by this facility. Further to that, we then said that the equipment that comes here, the equipment must be the latest. The reason is that for women to have safe delivery, they require an environment that is properly equipped to support delivery. I am very happy to report today that from the time we broke ground in December last year, we now have a facility that ranks among the very best in this country. We have worked well with the contractor, we've worked well with the county government, and the project was completed within 7 months from the time of breaking ground. And so it is our hope that as we go forward, the very high maternal deaths will come down. Indeed, we are looking at having that number from 550 to about 300 over the next 2 years. And it is possible because this county government has got from the community health promoters, they have people who are trained, who will support the women from antenatal to the point of delivery and postnatal. We have seen that already the young children are getting immunization in this facility. It means that even infant mortality rates will substantially come down. And so we want to commit as Safaricom PLC, as M-Pesa Foundation, as Safaricom Foundation, that we're willing to work with this county government to ensure that maternal and infant mortality rates come down substantially. Thank you.
My name is Evelyn Olonde. I'm a nurse, the nursing officer coordinating nursing services in this facility. That is Awendo Sub-County Hospital. I've been here for the last 7 years as a service provider working in immunization department. Right now, I am overseeing the nursing duties in the whole of the facility. Awendo is a hospital that is serving a population of 27,000 people. That is around 900 women or on reproductive age, around 800 of them in a year. In a month, we serve around 80 women coming for deliveries in our facility. For the immunization, we see around 75 children coming for antigens in this facility. So generally, I can say it is a busy facility. We offer immunization services on a daily basis, that is Monday to Friday. But all other services like delivery, postnatal clinics, that one we do 24 hours, 7 days a week. Before we came to this building where we are now, we used to have a very small NCH and maternity. And when the Migori County government came with the M-Pesa Foundation team and saw where we are working, and we gave them the data of the women we serve, of the children we serve, and the people, the number of women that we refer to MCRH, that is Migori County Referral Hospital, in a month, then they saw it that we needed a facility where we can give comprehensive services, including theater. The journey started way back in 2024, around November. And we are glad that today, September, we are already using this facility, having this structure done by M-Pesa Foundation and equipping done by the county government and even the staffs. Initially, we had a staff shortage, especially in the maternity part, but we have been given the nurses. We have been given a doctor, and that is a plus. We have an anesthetist who will be working in the theater because we now have a theater. These are the cases that we used to refer to Migori. When a delivery is complicated, we refer the mother to Migori. This was even making us to lose some of the mothers or even children along the way, because the time you take from preparing this mother, getting ambulance and taking her to Migori, that is quite some time for a complicated case. So with this building, expecting our first cesarean section tomorrow, I think it is a plus. So far, we were here on, let me say, we came here last week on Thursday, and the number of deliveries that we've had is about 28 mothers coming for deliveries. For the children, I cannot even mention. The numbers are there. It is seen outside. We see around 80 children in a day coming for CWC services, postnatal. And also remember, we are in Nyanza. We also give mother to child prevention of HIV transmission services in this facility. So everything for the mother and child ends here. We don't have to refer the mother to the other facility, to the other block. Go and get your drugs. Go and get this. Go and get tested. We do everything here. So to us, as the nurses or the healthcare workers in this facility, we believe it is a plus, and it is really going to help us. We are going to reduce the number of women that we are referring. We are able to now accommodate so many mothers. Initially, our postnatal clinic had a postnatal ward had only 4 beds. We were forced to put 2 mothers per bed, which is not hygienic. Remember, these 2 mothers are sharing a bed with 2 babies. It was not right, but we had no choice. Right now, we have a postnatal clinic or postnatal ward where we are able to accommodate 15 mothers. That is very good. The community members are happy with this facility, and I can say they are utilizing this facility, because we only came here last week and we already had around 28 to 30 deliveries. Even right now, there is a mother on the couch waiting to deliver. They have really embraced this facility, and I believe with time, we will be able to improve the health of the mother and the child for this community. It's not only in our Endo sub-county. We are getting clients from Uriri sub-county, neighboring sub-county, Homa Bay County are bringing their clients here. We get clients from all over, even Narok, because it is just some few kilometers away. They bring their clients here. So this facility for utilization is fine. Access is good because they are able to reach this facility. We believe now that we will be able to maintain such a number. And my prayer as Evelyn, is that this facility, another structure like this, be done to one of our sub-counties also, so that the people also can also experience whatever we are getting. Thank you so much.